Hey, Savvy Social Workers. I am a little bit under the weather today, so my voice may sound a little raspy, but let's go ahead and get into a few practice questions. Let me also disclaim that these questions are from the Apgar book. So these are not my questions. I'm not claiming that I wrote them or anything like that. I'm just merely here to help colleagues understand how to better answer these questions. So now let's get into it. Upon intake, a client appears to be sweating heavily, jittery, and shaking. The client reports that he has been a heavy drinker of alcohol for many years, but has not had a drink since yesterday. He realizes that many of his problems are caused by his alcohol use and wants help in staying sober. In order to meet his needs, the social worker should first. Okay, so let's break this question down by first looking at what type of question is this? Is this what unit this question is from? Okay, so this there are some signs and symptoms in here, and it does seem like a situation, so that lets me know that this is either a unit 2 or a unit 3 question. However, it also has information about substance abuse, which we know is unit 1. So I wanted to throw that in there because we know that majority of the substance abuse questions or situations are unit 1. So that is going to be the one that takes the precedent. So I want to acknowledge first that this is going to be a unit 1 question, even though there are signs and symptoms in here that represents unit 2, as well as, you know, they're giving you an overall situation. What this is really about is substance abuse. So this is going to be a unit 1 question. All right. So now get into it. We are in an intake. It says upon intake, so that lets us know that we are in the beginning phase of the helping process. So we should be focusing on engaging and assessing the client only. And when I say engaging, I mean developing rapport, and assessing, I am referring to gathering information about the client's presenting and priority problems. That is what we're assessing, their problems, nothing more, nothing less. This is where we focus on the biopsychosocial assessment and the client's history. So in an intake, a client appears to be sweating heavily, he's jittery and shaking. That is my presenting issue. This is what he's presenting with. This is why he's here, okay? So now, the client reports that he's been a heavy drinker, he hasn't had a drink since yesterday, all of that. He realizes that many of his problems are caused by his alcohol use and he wants help in staying sober. That's going to be our priority focus right there. The fact that he is trying to stop drinking and he wants help to stay sober. So this question gives us what I like to refer to as a snippet. Those who have had me for individual or group sessions know exactly what this means. This snippet that gives you just a little bit of information right before they ask you the question. That means you have to pay attention to that. Your answer has to be based off of this snippet, yet still addressing the priority issue, okay? Now next, we're going to pay attention that this is the first question. And of course, with first questions, I know a lot of people teach that you want to, you know, put them in order and do all of that good stuff, which is, you know, a lot going on. For me, I teach that you just simply focus on what is most important, because if it's most important, it's going to come first anyway, right? So let's recap. We're in an intake, which lets me know we're at the beginning phase of the helping process with this client. He comes in with these symptoms. His main issue is that he now realizes pretty much the error of his ways from drinking, and he wants help in staying sober. Okay. So the question is asking in order to meet his needs. So that means what is going to be the most important thing that we need to do to meet this client's needs to help him stay sober? Is that going to be A, develop a relapse prevention program aimed at avoiding external and internal triggers? Is that going to be the most important thing that we want to do in this moment? Absolutely not. Not developing a relapse prevention program while he is in the moment, sweating heavily and doing all of that. So A is definitely out. Refer him for a medical evaluation to address any immediate withdrawal concerns. Well, it is clear that he is having immediate withdrawal concerns. In the moment, he's sweating heavily, he's jittery, and he's shaky because he hadn't had a drink since yesterday. So this is a possible answer. So we're going to pause that and go to C. C, Connect him with a self-help group that can provide ongoing support of his abstinence. Again, he does want help staying sober, but the priority issue in the moment is that he is having some withdrawal symptoms, which is what he presented with. So us referring him for a medical evaluation to take care of these medical issues first is going to be most important for the withdrawal. So I put this question first because this question could be a little tricky, because we want to, of course, address the priority issue. He wants help in staying sober, but we also know that whenever there's some physical issues, we have to take care of that before anything else. So let's take care of these withdrawal symptoms that they're showing he has, and then we can move forward, okay? The other thing, drug and alcohol withdrawal can result in physical and emotional effects. Alcohol can produce the most dangerous physical withdrawal. So y'all have to know that. He comes in and he's withdrawing from alcohol. That is a danger in itself. Suddenly stopping alcohol or any tranquilizers can lead to a person having seizures, strokes, or even heart attacks. A medically supervised detox can minimize withdrawal symptoms and reduce the risk of dangerous complications. Okay, so whenever someone is trying to get off of alcohol, it is best to do that under medical supervision, because some of those dangerous symptoms of alcohol withdrawal can cause, like I said, those seizures, those heart attacks, strokes, hallucinations, all that. So we want to get this client under medical eval for these withdrawal concerns. That is going to be the answer that we need to choose. And again, yes, we want to help him stay sober because that's what his priority issue is. But really and truly, the fact that he has the medical issues, that's going to take more priority than the fact that he wants to stay sober. So I'm stressing that because I know a lot of the other questions you are basing your answers simply off of the red. But this question we have a medical emergency, so it kind of changes the game a little bit. Also, let me point out that the snippet, when I told y'all that this is going to be directly related to the answer you have to pick, it says in order to meet his needs. What does he need in this moment? So whenever it says in order to meet the client's needs, we want to automatically think about Maslow's hierarchy of needs. And so this is going to be the most important way to meet his needs as well. Even though he wants help in staying sober, he needs help with these withdrawal symptoms. So I want to point that out as well, which is another reason why our focus is going to be mainly on meeting what he needs, because of this little snippet right there. Question 2. A client has been seeing a social worker to deal with the stress of caring for her aging parents. The client is also a single mother with 3 small children. Since the first appointment several months ago, she has called and canceled many meetings with the social worker. What should the social worker do next? Okay, so a client has been seeing, so that lets me know we are in the middle phase of the helping process, because we've already started the working relationship with this client. The presenting problem or the initial issue here is that we have a client that's seeing the social worker to deal with the stress of caring for her aging parents. That's why she is seeing the social worker. The priority issue is that since the first appointment, she has called and canceled many meetings with the social worker. So that means she has not been consistent with her treatment. So what should the social worker do next? So this is the next question. And of course, with next questions, we want to look at what the last thing the social worker already did. And in this case, it does not say. So that means we are going to go right here to where the priority problem is and do what comes next after that, since it doesn't tell us what the last thing the social worker did. So because his client has called and canceled many meetings with the social worker since the first appointment several months ago, what are you going to do next after social worker? After realizing that this client is continuously calling to cancel her meetings. Okay. Now, we always want to remember that we consider the situation, but we focus on the problem. The situation is that she's dealing with the stress of caring for her aging parents as a single mother of 3 small children. And the problem that we're going to focus on is that she can barely make it to her social work meeting or to her therapy sessions, okay? So would the next thing that will address this be to assess the client's level of commitment to receiving ongoing social work services? That is definitely something we can do next, so we're going to pause that. B, determine whether services can be delivered more conveniently. That's also an option, so we're going to pause that. C, inform the client that she will be charged for missed appointments as a way of motivating her. Definitely no. We don't want to threaten the client to try to motivate them. That's just not what we're going to do. D, terminate services with the understanding that she can return if needed in the future. Okay, so that's not going to be the very next thing we do, because we at least want to have a conversation with the lady before we just terminate. Okay, so we know that D is out. So that means we have B. Either we want to assess her level of commitment, or we want to determine if we can kind of find a more convenient way for her, especially considering that we know that she's caring, considering the situation that she's caring for her aging parents, and she's a single mother of 3 small children. So of course, already putting it like that, the fact that she's canceling all these meetings, let's determine the next thing after we kind of realize that. Let's see if we can determine whether we can provide service to her more conveniently. Maybe that would include teletherapy. You know, maybe that would include her having sessions only once a month instead of, you know, every week, if she's saying every week. Okay, and then we can kind of move forward from that. Assessing her level of commitment is still not going to address the fact that it's still not going to address the fact that she's not showing up for her meetings. You know, it's going to tell us what her level of commitment is, but we already kind of know that, you know, she's dealing with a lot. So in this scenario, the client is actively reaching out to indicate the inability to attend the appointments, which demonstrates some engagement. So that is in so much itself showing you that she is committed. She just can't make it. It's not like she's not showing up. It tells us that she has called and canceled. Okay, so that demonstrates that she is engaging. The client has many demands on her time that may be the cause for her poor attendance, which it seems like. So at the next meeting, whenever you meet with her, or, you know, when she calls to cancel again, the social worker should discuss the absences and, you know, kind of brainstorm with her as to whether her needs can be met in a more accessible manner. Like I said, maybe just doing once a month, or even offering teletherapy, where she does not have to leave and drive to an appointment or try to find care for her parents or for her children while she comes to the appointment. So B is going to be the next thing that we do. And keep in mind, y'all, whenever you are picking an answer, it has to, number one, help the client. It has to be an option that actually helps the client. Okay, so we're not just picking answers to pick the answers that seems like the most logical thing to do. We are actually trying to help our clients. So whatever intervention that you employ, it has to actually help the client's situation or their problem. So that's why just assessing her level of commitment, that's not really providing any help to the client, but helping her to brainstorm or determine if, you know, there's another more convenient way for her to be able to attend her sessions. That would be the most helpful. A social worker believes that a client is experiencing signs of trauma from a devastating event in his life several years ago. The most effective method for determining the existence of these symptoms is through. Okay, so we have a client that's experiencing signs of trauma from a devastating event several years ago. Okay. The question is asking, what's the most effective method for determining the existence of these symptoms? So this is a Unit 2 question, because whenever they're asking you to either assess or diagnose something along the lines of gathering information, that is going to be a Unit 2 question. So what is the most effective method for determining the existence of these symptoms? Okay. And the symptoms being, you know, the signs of trauma from his event. So how do we determine, or how do we assess the existence of that? Will it be A, by a subjective self-report from the client? Okay, Will we do a subjective self-report by the client? Possible. So that means we would just go off of what the client is telling us. Like, okay, the client is telling us, okay, yes, I am having issues due to the trauma that I experienced. So that's a possible answer. B, psychological testing of the client in a controlled setting. Is that going to be the most effective method by giving him psychological testing in a controlled setting? I don't think that's going to be the most effective method to tell if he is experiencing signs of trauma. C, objective data contained in the client's file. Is that going to be the most effective method? No, it's not, because it's objective. So definitely don't want to do that. I mean, that's not going to be the most effective way. We do use that information, but it's not always the most effective way. A lot of times, and I will just say, coming from the horse's mouth itself is going to be the most effective way. But we're going to also see what D says. Medical evaluation of the client by physician. So how is a medical evaluation, just the same thing like psychological testing, how is a medical evaluation going to tell us if the client is experiencing the signs of trauma? Now, I'm not saying that it's like not possible at all, but we're trying to find the most effective way to see if this client is experiencing signs of trauma. How will we know those symptoms? And that would be a little bit more difficult to tell during a medical evaluation. So this question requires social workers to know the effects of trauma, right? So the signs are seen in everyday life, and it can include things like physical problems, like being tired all the time, muscle tension, racing hearts, and all of those things. However, they are best assessed by speaking directly to the client. Like I said, getting it from the horse's mouth itself. Whenever you are trying to get symptoms, let's get them directly from the clients, okay? Especially when you're asking about symptoms of something. You're not asking him to tell me about a situation that he could easily, lie about or whatever. This is symptoms. The client will best know his symptoms more than anything that somebody else has observed, okay? So, if for this question, it is very important for you to know the difference between objective and subjective, okay? Understanding the client's thoughts and feelings is essential to determining the impacts of these stressful life events on his well-being. So by him giving you a self-report of how he's feeling, or, the thoughts he's having, or any of those things, that will give you the best indication on whether or not he's experiencing signs of trauma. A client has a son with a rare genetic condition that significantly limits his functional abilities. She is a single mother and feels very isolated. The client does not like to talk to her friends about her struggles and does not know anyone else in the same situation. She admits that the pressure of her caregiver responsibilities has recently caused her to engage in self-destructive behaviors, such as drinking heavily, overeating, and excessive spending. In order to best assist the client, the social worker should recommend. Okay, so there's a lot going on seemingly in this situation. So we have a client who has a son with a rare genetic condition that significantly limits his functional ability, okay? So the presenting problem is not going to be about her son, because we are looking at the mother or the woman as the client. So the presenting problem is that she is a single mother and she feels very isolated, okay? So she don't like to talk to her friends about her struggles and don't know anyone in the same situation. She admits that the pressure of caregiving has recently caused her. This is going to be our priority, okay? So keep in mind, it doesn't really tell us where we are in this process. So that means it's not going to be relevant to our answer. So we have a single mother who feels isolated, and her main focus that we need to be trying to address is that she's admitted here, okay? So the question, it gives us a snippet in order to best assist the client. So we know that best means we meet the client where they are and do the most beneficial thing, okay? So we want to make sure that our answer is going to be best assisting the client with her priority issue of what she's admitted here about engaging in self-destructive behaviors. Okay, so what should the social worker recommend? So they're asking you what's going to be the most beneficial thing to recommend to the client who is feeling alone and admitting that the pressures of life is causing her to engage in self-destructive behaviors. Okay, is it A, intensive individual psychotherapy to address her self-destructive behaviors? Is that going to be the most beneficial way to help this client with that? Possibly, so let's just pause it. B, a support group of others who have children with similar conditions. That is not necessarily going to best assist her. That is definitely something we could do, but is that going to be the best thing to help her because she's admitting to the pressure? Giving her a support group will help her not feel so alone, and it will address this part, which we'll talk about in a minute. But is it going to specifically address the priority part? I don't think it will, so we will eliminate that one for now. C, recommend case management aimed at assisting her with coordinating care to reduce her caregiving demands. So basically this is saying that we will recommend to her some caregiving that's going to reduce the amount of caregiving that she needs to do. Is that something we could do? Possibly, so we'll pause it. All right. D, individual and group counseling to address personal problems and provide support. So looking at what the presenting problem is, she's a single mother and she feels very isolated. Okay. And she also tells us that she don't like to talk to her friends, but she doesn't know anyone else in the situation. Her main issue is that because of the pressure of her caregiving responsibilities, it's causing her to engage in some self-destructive behaviors. So providing her with individual and group counseling to address her personal problems and provide her support could also be an option. So y'all, I hardly ever get down to 3 answers. It's normally 2 for me. So let's go back and let's kind of break them down again, starting with A. Is giving her intensive individual psychotherapy to address her self-destructive behaviors. That is going to take care of one part of the problem. Okay, that's not going to take the pressure off of her caregiver responsibilities. Okay, so we are going to eliminate that because it only takes care of part of the problem. And remember, we have to do what is the most beneficial for the client that's going to address the entire priority problem. We can't pick apart the priority problem. Okay, also looking back at C, case management aimed at assisting her with coordinating care to reduce her caregiving demands. That is also going to help her with her caregiving responsibilities, but that's not going to assist her with these self-destructive behaviors that she has developed as a result of that. So again, just like this one, this one is only addressing her self-destructive behaviors. This one is only addressing the caregiving. So I want y'all to see that it has to address the whole problem. So that leaves us with D, which will address individual for her personal problems and group for the caregiving. We can find her a support group like B, but she's definitely going to need both individual and group support. So keep in mind, y'all, that a critical factor in deciding what is best, whatever it's a best question, is identifying the root cause of the problem. So what is the root cause of the problem? You know, we got to get to that root. And so we make sure that we address the root. She's a single mother. She feels isolated because of her son. So that's why she's drinking. That's what's causing these personal problems for her. So in order to get to the root of the problem, we're going to have to do her some individual therapy and then also providing that group counseling to help her out with the situation with her son, getting her in a group where, like, for instance, be in a support group where maybe other children who have, other parents who have children with the same issues. Then we can do all that. But the best way to assist her is to give her both individual. Okay, the use of both can assist the client to discuss her unique struggles with handling caregiving in a manner that is confidential and more personal. So that's where the individual comes in at, okay? And with the group counseling, she can obtain support of others to reduce those feelings of isolation, as well as share in, with other people, other like-minded people who can very well understand and encourage her about what she's going through. So the answer for this one would definitely be D. So what I said I want to double back to and come back and show you all is that the way that the Aswb exam structures a lot of these questions, especially the clinical intervention questions, where they will give you these problems inside of the scenario and will have an answer that directly matches it. So for instance, a client has a son with a rare genetic condition that significantly limits his functional abilities, okay? So if we focus on that as being the priority problem, then we will probably want to do B. Okay, the same thing if we focus on this problem. The client does not like to talk to her friends, but she doesn't know anyone in a situation. We will more so want to focus on B as an answer for that. Okay. Then if we just focus on the fact that, like I said, that she has the pressures of caregiver responsibilities, if we only focus on her having the pressures of that, then we would want to do C and only address that. Or let's just say you decided to focus just on the fact that she now has self-destructive behaviors such as the drinking, overeating, and excessive spending, then you would want to do intensive individual psychotherapy just for that. So what I'm trying to stress is you can't just focus. You got to make sure, first of all, that you have the right focus. And then when you're focusing on the priority problem, you can't pick it apart. It has to be the whole thing as in its entirety. Okay. So again, the individual will be for her personal problems, and the group will be for the more general problems of her caregiving and just not feeling isolated, to have someone to share in those struggles. So I know I took a little bit more time on this question, but I wanted to make sure you understand the gist of what's actually going on with it. A client who has made substantial progress in treatment is in the process of termination. She starts missing appointments which have not occurred in the past. This behavior is most likely an indication of, okay, so this is not telling us anywhere, anything specific, but it does tell us a specific place of where we are, okay? So it's telling us that we are in the process of termination. So we want to pay close attention to that. So when I say it's not really telling us anything specific, that's in regard to the presenting problem, because it's just saying that a client who has made substantial progress. So that's not really any specific problem or whatever. So but we can still highlight that as being our presenting focus. But I just wanted to point out that it's not, the specific or the usual presenting problem that we're looking for. We're in the process of termination. So there are not usually a lot of questions about termination. So that's why I wanted to do this to give you just a different mindset and perspective of what to do when and if you get a question about the termination process. Okay. So the main issue here is that she starts when we're at termination, all of a sudden, when it's time to start terminating, all of a sudden she starts missing her appointments. And this is something that she has not done in the past. Okay. So the question is asking you, this behavior is most likely an indication of what? Okay. So why? All it's saying is what would make the most sense for her to be acting like this, for her to start missing these appointments now that we're headed toward the process of termination. Okay, so we're looking for the most likely indication of why she will be missing appointments toward the end of her process. Okay, so would that be A, continuation of her original problems? So termination is premature. So is that why she would stop missing, because she's had a continuation of her original problems? So that means we're terminating her too premature. Is that what this is going to be an indication of? Why she's missing appointments, because her original problems have resurfaced or they continue? Don't really think so. So I'm going to eliminate that one. Would it be because her readiness to end services by placing other activities as priorities over making appointments? That could possibly be it. Like, when somebody feels like they have achieved a goal, then they move on to something else. Or maybe she's not feeling like she really needs the services. They're not as important anymore because she has achieved her goals and she is ready to tap out of services. So, they kind of start getting inconsistent. So I think that's a good choice. But let's see what the rest of the options are. C, emergence of a new problem in the client's life that needs to be assessed. Well, it seems like to me, if she had a new problem, she would not, that would be the opposite. She would not be missing appointments. In some cases, and maybe whatever, if it is something that's going on that's keeping her away or whatever, could possibly be. But, in my experience, I feel like if she had a new problem, that would really make her want to continue to be engaged in therapy, however, so that she won't be terminated. But we'll leave that one because that one could be either way. So we'll see. D, anger toward the social worker for ending the therapy relationship. Would this be why she's missing, after she's made substantial progress? Would this be why she starts missing appointments because she is mad? In some cases, possibly, but I don't really think that's the most likely indication of why she would be missing her appointments, because she's upset with the social worker. Okay, because we already, know that this is discussed early on and throughout the process. And that's not to say that she can't be mad or feel some type of way, but I just don't think that would be the most likely indication of why she would just start missing appointments out the blue. All right, so now we're back to B and C, which I think both are really plausible answers. So would it be that her readiness to end services, that's indicating that she's ready, and so now she is not prioritizing it, she's now prioritizing other things over making those appointments? Would it be that, or that she has encountered some new problems that needs to be assessed? So in my thinking, if she's encountered new problems that needs to be assessed, she probably would not be missing these appointments. Okay, in this scenario, which has to do all about with her missing the appointments, that can be a sign of resistance or a lack of motivation. When people start when they're not showing up, that means either they're resisting it or they're not motivated to do it. So because this behavior emerged during termination at the end of our problem solving process, it is probably resulting from the client placing other activities and responsibilities as priorities over making the appointments, because it's at the end. She's like, well, I've done my work. I'm done. I'm feeling better. I reached my goals. So now getting to the end or being at the end, is probably not that important to her. And I'll just kind of throw in, just line you up, because I'm thinking about this now that I've been kind of sick. Normally when we're not feeling well, we go to the doctor or we'll get medicine and we'll take the medicine. And as soon as we start feeling better, we're like, oh, well, I don't need to finish taking the medicine because I already feel good. I'll just go ahead and throw this medicine, the rest of it in the medicine cabinet. At least that's what I do. So that's what made me think about this situation here. Once you start feeling better, it's almost like, oh, I don't need the service anymore because I'm doing good or I'm feeling good. So you start prioritizing other things over it. So that sounds like what could be here. What could be going on here. The client should not be blamed for such behavior, and it doesn't mean that any of her old problems continue or that new problems have emerged. And like I said, it's probably not likely that the client is angry. The meetings may be losing their value or importance to the client because the problem has been resolved. Just kind of like I gave y'all that medication illustration. When the problem is resolved, like once I stop, all this sneezing and coughing or whatever I'm doing, then I'm not going to be worried about taking medication because I'm going to be feeling good, right? So the social worker should not drag on services longer than needed. So said all that to say, I went the long way, that the answer will be B, that her readiness to end services by placing other activities as a priority over making appointments is most likely the indication, especially because she's already made substantial progress and we're at the end of termination. A social worker learns that his client is a close personal friend of his supervisor. Neither the client nor the supervisor is aware of this situation. In order to address it ethically, the social worker should. So we already know out the gate this is an ethical question, And so we have the issue here that the social worker learns that his client is a personal friend, close friend of his supervisor. Okay, so that's my initial issue. The thing is, neither one of them know about it. The client nor the supervisor knows about it. So they give us a snippet here in order to address the situation ethically. So that means whatever answer you choose to address this issue, it has to be ethical. Okay, so what should you do? What is going to be the most ethical thing you need to do, being that you have a client that's close friends with your supervisor? Keep in mind that your supervisor is the person that you discuss cases with and things of that nature. Neither of them know. Okay, is the most ethical thing going to be to keep the circumstances confidential, not disclosing it to either the client or the supervisor? I can tell you that that is not going to be the most ethical thing that we need to do, because you never know in supervision, a situation may come up, especially even if you might not even have to say a name, but because they're close friends, you may be discussing the situation, the supervisor recognizes the situation, anything like that. So that's just not going to be ethical. B, refer the client to another agency in the community. That's not going to be the most ethical thing. In some cases, this could be a solution, let me say that, but it's not usually going to be the most ethical thing, so we'll eliminate that one. C, inform the client of the situation and arrange for alternate supervision within the agency. So this does sound plausible to say, okay, because this is my client, I'm going to get someone else to supervise me so that when I'm staffing this case, or at least for this case, when I need to staff this case, I will staff it with someone that's not the client's friend. So that does sound ethical. Or we can ask the client if this situation poses a problem, right? Just because we're asking the client, that still doesn't make it ethical for us to be discussing the client's business with our supervisor, especially because they're friends, they have a dual relationship that could pose a conflict of interest. So the question requires that, like I said, the situation be addressed ethically. So the social worker should be alert to and avoid conflicts of interest that interfere with the exercise of professional discretion and impartial judgment. Okay, so that means we don't want to be discussing the friend situation with a supervisor who's also a personal friend, because that could lead off to some impartial judgment, some biases, or some personal discretions. Okay, the social worker must inform the client when any real or potential conflict arises and take reasonable steps to resolve the issue in a manner that makes the client's interest primary, and it protects the client's interest to the greatest extent possible. So because of that reason, that's why not disclosing it to the client is inappropriate. Okay, so in this, the best case would just be to switch supervisors, not send the client away or whatever. It would be much easier just to say, explain what's going on and switch supervisors for this case. So the answer for this one is going to be C. Okay. Again, y'all, I know I took a little bit more time on these questions than I normally do, but I tried to pick some really good ones. And like, again, I want to disclaim that these are questions from Apgar. And so I just these were some really good questions. And so I wanted to make sure that I was giving you thorough breakdowns on these so that you can understand, because these are questions that I feel like could be answered in more than one way. And this is what kind of trips people up on the exam. So I wanted to make sure I took my time with these and answered them as thoroughly and in depth as possible. Of course, if you have any questions, drop them down below. Even if you don't have any questions, I always appreciate reading your comments, as y'all don't know how much it motivates and inspires me to continue on, especially making these videos that I normally don't have a lot of time to make, but I like to push myself to do it because I know that you guys are looking forward and that is helping you. So I do appreciate each and every comment, which is why I always try to respond back as I have the time. So again, thank you all for being here. I appreciate all the support. And again, let's continue to get those passes the savvy way.